CBT and light on anxiety's version of CBT is different from, I'd say, the movie versions of talk therapy, because in reality, the way that we are creating the change with our clients is we're talking, we're communicating, we're listening, we're sharing ideas. So it's really sort of the image that often comes up, I think, for all of us when we picture talk therapy. It could even be maybe a client lying on a couch and talking about their mom and the things that went wrong with them that's got them to this point in their life. And we do have to identify what aspects of history that have led us to the moment in order to explore, in order to create more effective brain wiring to allow for positive change. But that moving from reviewing the past, if I had to break down a component, maybe it's 5%, 10%, depending on the situation. And the majority of the therapy work in cognitive behavioral therapy is spent in a very action-oriented posture. So we use the analogy of going to a brain gym where you're doing hard work, you're doing really powerful work. You may feel the muscle tension as you're doing it. And we really speak to the exposure-based therapy model where the only way through anxiety, the only way past anxiety is through it. And so as we are facing anxiety, there's going to be short-term discomfort. And that's how we know we're getting things cooking and we're starting to make contact with the stuck points. And then we're going to really at those moments play with, engage with the discomfort. And then, so similar to maybe lifting weights, that is going to be an uncomfortable couple of moments. And in the process, you're building up new muscles. And it's the same thing that we're doing with, we talk about short-term discomfort, long-term gains versus what traditionally happens with anxiety is it is so uncomfortable that there's so much avoidance that one engages in. So, oh no, if I go to that party, I'm gonna have to make small talk. I'm gonna feel so uncomfortable. I'm gonna have a panic attack. I'm not gonna go. Woof. I feel so much relief. So the way anxiety disorders work, there's short-term gain. I feel so much better. Long-term discomfort, I've just taught my brain that, in fact, that was really dangerous. So similar to the body in the gym, it might feel short-term. I'm going to just sit on the couch and eat a bag of chips, which we all deserve to do sometimes. And in that moment, we're going to feel a little more comfy, or a lot more comfy, a lot more better. But in the long term, is that moving us in the direction of our values? We go to the gym, have some discomfort, and in the process, we're getting stronger. So that's really a different experience that you're going to have. And if you walk into any light on anxiety office, what's happening in the therapy rooms, there'll be individuals doing things in a very active way. And that could be touching things. It could be writing scripts to start relearning experiences. Could be standing and doing jumping jacks to teach their body how to move past panic attacks. So we're doing a lot of things together with the therapist to move past mental health obstacles.